Hello there. Have a great day, everyone. I am Kimberly Ann Cimafranca, and today I will discuss about consumer health information. May I request everyone to please listen and be attentive because today let's know a bit about our new topic. So the first slide is a picture about our topic today. So the middle of the picture is a technology that gives information that surrounds people, and the people are the consumer, the health consumer rather. And our topic today is consumer health information. So this picture, even the healthiest of people find themselves in the role of patient at the same point. In their lives, increased consumer-driven world of healthcare, individuals will can be called upon to make crucial decisions regarding their own health. So the next slide is what is consumer health information or CHI? Consumer health information is information on health, medical condition, and medical topics available to general public at the layperson level. So information intended for potential users of medical and healthcare services. There is an emphasis on health and self-care rather and prevented approaches, as well as information for community-wide dissemination and use. So, consumer health information strive to ensure patients and their family members have access to timely, quality health information to aid better decision making and to achieve behavioral changes and disease management goals. And it is very important that we know about this health consumer health information because many of information are not reliable, and we need to be aware of those fake information. So the next slide is all about health consumer. So who is health consumer? So health consumer representative is a health consumer who has taken up an specific rule to provide advice on behalf of consumers with the overall aim of improving healthcare. So health consumer have a knowledge, the information that give information to those people that surrounds in the community. So, health consumers are people who use health services as well as their family and concerns. These include people who have used health services in the past or who could potentially use the services in the future. So, usually, this rule will, with a health service or consumer organization such as the the doctor, the nurse, the staff, and the community participating, and even other people who have the already experienced the health services in their community. So the next slide is there is a chart about psychosocial factors. So in psychosocial factors, there are three important things to remember: the need, the access, and evaluate. So this is important for consumer health information. In psychosocial factors, we have the cognitive, affect, knowledge, skills, and attributes and beliefs. So in cognitive, we need to know the facts, the fake news, or the other information that we will use in the future. So what is good for us? The effect that affect in our daily life, and the knowledge, we have the knowledge, the will help us to improve our life and better for better concerns. And the skills, we have the skills that provide our health services, and we have we have the information to guide us and attributes belief. So in psychosocial factors, the need, access, and evaluate. The need, we need to ensure the information that is reliable for us. And access, we need to access those information sources that is trustworthiness, credibility, availability, personal support, and intended message. So in evaluate, we need to evaluate ourselves, our healthcare services, that this is good for us in our daily life, in especially in our future. Those informations that help us to be healthier and be good always. And there is a channel, the interactivity, modality, accessibility. So in consumer, we use task attributes, the goals, the decision-making style, and perceived message. So in family and friends, community, healthcare providers, online health information systems, and health and information medicals media. So that is a psychosocial factors. In environment, that influence the organization, the resources, the global context, the social, cultural, and economic political norms that influence ourselves through our that surrounds in our environment. So the next slide is the example of consumer health information technologies. Why is technologies? Because we are getting the information by the use of technologies, especially in online. The first is personal health records. So personal health records, this is new consumer health information technology or health or HIT, because is an application about your personal health records. So in smart record cards also, this is being developed that allow patient to manage and use your smart card through your healthcare services. So in clinical email also, a clinical email communication that control their health information electronically and to assume more active role in communicating. So in online pharmacies, we have the man. So the next slide is consumer health education. Consumer health education and health information is the data and facts you got from media and people, including the professionals and agencies. So consumer health education, it is very useful and important for those people who didn't know, who didn't care about their health, and especially those information that are reliable. So the next slide is what are the three advantages associated with the health information exchange? So here's the advantages. The monitoring, improve public health reporting and monitoring. So in this statement, monitoring public health reporting aims to communicate the state of health of population, all who need support. So the next is engage healthcare consumers regarding their own personal health information. So this is very important, especially in an emergency. You can quickly give first responders vital information such as disease you're being treated, medication you take, and those healthcare services. So third one is improve healthcare quality and outcomes. So the quality improvement, patient outcomes to standardize process and structure to reduce variation in achieving predictable results. So na-predict na nimo ang results? No. We need to have more research about this in order to you to improve your healthcare quality and outcomes and reduce health related costs. So this is reduce variation to achieve predictable results, optimize coding and billing, and establish models to improve health outcomes. So the next slide is, so this information about consumer health information that every person have a right information, right way, choose the right time, right people. Everything you need to choose that right for you. So the next slide is the last slide. Consumer rights and responsibilities. So being good consumer means knowing what to look out for and what to avoid. It means know where and how to get the best value for money and where to go if things go wrong. Your role as a consumer has both the right and responsibilities. And that's all for today. Thank you and God bless.